This is the National Report for Tuesday, September 14th, 2021. I'm Leslie Ann Johnson. In the headlines, additional adjustments made to accommodate growing number of COVID-19 patients at the General Hospital. Details to this story and more after the break. And now for the news in detail. Additional adjustments have been made at the General Hospital to accommodate the growing number of hospitalized COVID-19 patients, which as of Monday night stood at 68. Recently, increased capacity was achieved through the conversion of the newly constructed neonatal intensive care unit and retrofitting of the pediatric ward. With even more adjustments made to convert the male and female medical wards, the hospital now has a 93-bed capacity, which means there is room to accommodate more patients. The good news is that 10 people have been discharged in the last few days. Giving a breakdown of figures at other medical facilities around the island, Acting Director of Medical Services Dr. Taisha Donnell said a centenarian is currently the only COVID-19 positive patient at the Princess Royal Hospital, while there are 9 at the Princess Alice Hospital. At the Mongay facility, where preparations are being made to set up a 10-bed unit for COVID-19 patients, 1 person remains in stable condition. At the Richmond Home for the Elderly, Dr. Donald says there are 13 positive cases, but the majority are vaccinated, so they are only experiencing mild symptoms. And at the Top Hill Home in Carriacou, there are a number of cases and they are in stable condition. Grenada has 2,646 confirmed cases to date, of which 548 have recovered and 2,063 are active. Of the total number of active cases, 8 are imported and 2,055 are local, with 53% being female and 47% male. Those affected range in age from 2 months to 103 years. The cases are scattered all over the mainland and on the sister isles. 35 people have died from the disease, ranging in age from 18 to 101. Medical officials say all of them were identified as being high risk for severe illness from COVID-19 because of underlying medical conditions. Only 1 of that number was fully vaccinated. Health officials in Grenada are growing increasingly concerned about the low level of vaccination rates in the country. With a population of just over 100,000, only 28% of Grenadians have been vaccinated thus far. As is happening in other countries, a significant number of COVID-19 cases continue to be among the unvaccinated. Statistics from that show that 81% of those testing positive for COVID-19 are unvaccinated. 5% have received their first dose of either the Pfizer or AstraZeneca vaccine, and 14% are fully vaccinated.
To date, we have administered 49,581 vaccine doses. The Ministry of Health rolled out Pfizer on August 23rd and have so far administered 6,574 doses. To further elaborate on vaccination, 29,645 persons have received their first dose, and 19,936 Grenadians are considered as fully vaccinated. We are a population of 113,000, thereabouts. Our eligible population for vaccination, that is, the number of persons in our population that are 12 years and over, is 93,763. So what does this mean? This means that only 21% of those eligible for vaccination are fully vaccinated. We still have a long way to go as it relates to vaccination, as it relates to community protection from COVID-19.
That's Senior Medical Officer Dr. Mayana Charles. She says in the past week there were 1,173 new COVID-19 positive cases, with daily average being 168. 2,063 are now isolated, while 356 are in quarantine. More than 64,400 PCR tests have been conducted to date. Samples are sent to CARFA for testing, and in the last week, 8 of the 11 samples returned positive for the Delta variant.
What does that mean for Grenada? Now, this variant multiplies far more rapidly in the human body than any previous known variants. In fact, the swabs that we take to detect COVID-19 reveal that people infected with the Delta variant have 1,000 times more viral particles in their upper respiratory systems than those who were infected with the coronavirus that sparked the pandemic in the first place. What does that mean? That means that with every cough, with every sneeze, right, this is packed with that much more virus, 1,000 more viral particles. If you think of the individual particles, let's say as a machine gun, right? The Delta variant is shooting at us 1,000 rounds per second, while the previous or original strains of the virus was shooting at 1 round per second. So this gives you an idea of how infectious and how easily transmissible this variant is.
With such a small percentage of people vaccinated, Chief Medical Officer Dr. Sean Charles is concerned that too many remain exposed and at risk, which is resulting in a steady increase in the positivity rate, which is now around 30%.
Our vaccination coverage is low, and it is low across the board. All right, we only have, about 21% of the population eligible to be vaccinated that are vaccinated. All right, so it means that the whole other, 79% or so, remain at risk. So that it's a dire situation. It's quite a dire situation. All right, that we are facing. All right, and that's why we want everyone to do whatever it is you can to prevent yourself from getting this disease. I cannot state that enough. The positivity rate has been coming up at around 30%, all right, averaging around 30%. So it means that about just around 1 in 3 individuals who are coming out there to be tested are testing positive. This we have seen repeated in different communities. What is that saying to us roughly? It is possible that up to a third of this population have been infected with this virus. And this is just a rough estimate based on testing that we have done around the island. So it means that it took about 3 weeks for this virus to infect about a third of the population.
Prime Minister Dr. The Right Honourable Keith Mitchell has used Monday's 16th emergency meeting of the Conference of CARICOM Heads of Government to bring his colleague heads up to date on Grenada's current COVID-19 situation. And he also endorsed a call for countries to work closer together in managing the pandemic. Dr. Mitchell shared that Grenada is in crisis given the exponential rate of infections and the number of deaths experienced in recent weeks. He identified a field hospital as one of the pressing needs for the country at the moment, a call which he said was repeatedly referenced during Monday's dialogue. The Grenadian leader said, and I quote, "For many months we witnessed what was happening in other countries, but now the problem has arrived on our doorsteps. And compared to some countries, we are in an even worse position. We are seeing an exponential increase in the rate of infections among the local population, and several deaths have occurred. The situation is dire, and we need urgent support for medical professionals. A field hospital is one of our critical needs at this point in time. I fear that our system is on the verge of being overrun, and we could have a serious problem." Unquote. Dr. Mitchell told his CARICOM colleagues that both health and security personnel are included in the number of infected persons, putting an additional burden on already stretched resources. With the 76th session of the United Nations General Assembly scheduled for later this month, the Prime Minister said it should be an opportunity used by Caribbean countries to lobby for help to address the pandemic. This is the National Report. More news after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Continuing the news, Minister for Legal Affairs, Carriacou and Petite Martinique Affairs and Local Government, the Honourable Kindra Mathurin-Stewart, says a contingency plan is being put in place to ensure residents and staff at the Top Hill Senior Citizens Home get the best care possible in the face of positive COVID-19 cases there. Minister Mathurin-Stewart says in addition to the 4 cases recently announced, there are now additional numbers.
We had 4 active cases there. Late yesterday, however, another 4 of the residents were tested positive. In addition to that, many of the staff members, the workers there, also contracted that virus. And so we are, together with the board and the management team of that institution, together with the matron, we are putting together a contingency plan to ensure that the residents there continue to receive the necessary care and attention that they require at this time. We also have 1 hospitalization at the moment. That person is at the Princess Royal Hospital and is receiving care and treatment. And I was advised that overnight that person improved tremendously, and very soon, with God's grace and guidance, that person will be going home.
Minister Stewart has also been making calls for people to get vaccinated. Carriacou currently has close to 60 active COVID-19 cases, while there are 5 active cases in Petite Martinique. She's pleased, however, with the turnout for vaccination and testing at Tuesday's pop-up clinic at the Hillsborough Tennis Court.
We will continue our efforts to get our people vaccinated, and so there will be another pop-up clinic at the Hillsborough Tennis Court on Thursday of this week for persons interested in being vaccinated, and also for the purposes of testing. And then we'll be heading to Petite Martinique on Friday, also for the purposes of vaccination and testing. And I want to use this opportunity to encourage all of our people, those of you who have not yet been vaccinated, to seize the opportunity to do so at this moment. We are where we are, and so we need to be able to get out of it. And the only way we can do so is by vaccination and by adhering to our respective protocols.
Ministry of Health officials are cautioning persons who are affected by COVID-19 to avoid waiting until it's too late to seek medical attention. They have noted that several deaths which occurred within 24 to 48 hours of hospitalization were attributed to persons seeking emergency care at an advanced stage of the disease.
We're noticing that a lot of persons coming in and dying are dying within a short space of time, meaning that persons are ill out there and coming to seek care at General Hospital in a very, tardy time. So by the time they get to the hospital, they're at the advanced stage of the disease. So I just want to appeal to the persons in the public, if you're feeling ill, please call for help. If you're unable to get through to our hotline and you have your own transportation, please come to the hospital. We'll take care of you. We really don't want you to be at home, sick, and not able to access care. And then, of course, come into hospital, when it's very late. So we just want to appeal to persons out there. In the early stages of the illness, if you're feeling fine, it's okay. But if you find you're having any red flag symptoms, as we call them, so dizziness, chest pain, weakness, dehydrated, confusion, please don't wait. Come to the hospital. We'll take care of you.
We should always remember what this disease looks like, what we should look for, because there are many persons in the population that need to be protected. And sometimes we are not paying attention to some symptoms. And as Dr. Donald stated, we have persons that are turning up at an advanced stage when it is very difficult for them to be salvaged. Now, I know that in some quarters, I've heard it being said, persons are saying it's a cold, it's the ordinary post-carnival cold. I've heard the talk. All right, just want to let them know that no, it is not. No, it is not. This is something entirely different, and this is something really serious. All right. Yes, some of the symptoms are familiar. Persons get fever and chills. They get a cough. They feel fatigue. They feel body aches and headaches and all of that. Similar symptoms. All right. They may get a sore throat, loss of taste and smell, runny nose, and all of that. All right. These are the symptoms that this disease is manifesting. However, there are persons who go on to experience what we call warning signs. And when those are present at any time, you need to seek medical care. You need to do so immediately so that we can stem the tide of that we are presently seeing. And those warning signs include trouble breathing. If you start experiencing trouble breathing, this is something serious. This is not something to wait. All right? You start experiencing persistent chest pain. The persons become confused. They're very dehydrated, as was mentioned. All right? It's very difficult to wake. All right? If there is changes in coloration of the skin, especially blue or grayish, all right, the person is difficult to arouse. These are warning signs. Persons, they should not wait. Medical attention should be sought immediately.
And that's the National Report. I'm Leslie Ann Johnson.